just wanted to talk to you a little bit about our sterilisation system and centre. I'm just giving you a little look around at all the various things here. We've got our autoclaves there, and we've got this colour-coded system here. So this particular area is our area where we do our instrument processing. But I'm going to hand over to somebody who knows more about it than me, and that's one of my valuable assistants, Lauren.
Hello. So at the moment I'm holding a used cassette. So this is for a restoration. So the dentist in the surgery has placed all the instruments and locked into the cassette, just like so. So they're placed in like this to get a thorough cleaning, to make sure all the areas of the instruments are, all the debris and everything has been removed. So we have an ultrasonic cleaner here. This cleans our smaller instruments, burrs and such, whereas this cassette will go into our thermal disinfectant washer. So the washer here makes sure that all the debris is removed from the instruments. The washer can fit quite a lot of instruments in here, and the load can go for about 2 hours. So this makes sure that the instruments are really cleaned. And we'll get back to that one.
That's okay.
Yeah.
So to get rid of biofilm.
To get rid of the biofilm.
Yeah.
And then they are thoroughly washed and then dried as well. So they're ready for packaging, the next step of the sterilisation process. The hand pieces. This is our
automatic oiler.
And the hand
cleaner.
Lubricator. Each handpiece is placed into the lubricator and has a cycle which cleans them and checks their air pressure as well. Once these are completed, we can go into the bagging area. So we can pop these in a bag, which will then go through the autoclave.
Okay, so how would we know that they've gone through the autoclave? What's the test?
So there are indicators on each of the bags that show us that the autoclave has reached its parameters of 134 degrees for 3 minutes.
Oh, goodness me.
So they're placed into the bag and we pop them on trays. Once we have some trays ready to go, we can pop them in the autoclave. We actually have a finished load at the moment, so I'll remove my gloves. What I need to get for next time. And I'll unlock the load so that we know exactly who completed the load and that the instruments are successfully cleaned. They are quite warm when we get them out, so we are careful. So we have some instruments in bags and some in a sterile wrap. So I print out barcodes for all the critical items. And now I'll just enter these into the computer so that we can find out exactly what instrument went through on what machine.
So when that instrument package is to be used for a specific patient, what happens then?
So for each instrument that's used for a patient, their barcode is scanned into the patient file. So we have a thorough record of everything that was used for the patient, what autoclave they came from and what cycle they came from.
Well, thank you very much. I think that was excellent. I've actually learned a little bit myself, and I knew you girls were good, but now I'm very impressed. Thanks very much.
Thank you.